name is Dr. Ravandi. I am a pediatric emergency medicine physician. So that means that I take care of young and older children, basically everybody from age 0 to 21 in the emergency department. So I take care of things like when kids break their bones, when they need stitches, when they have fever, and some kids who have other conditions. So maybe you or your friend has diabetes or some other condition that they need medical care for. I also take care of those kids. So this is just an example of one of my exam rooms, which you've probably seen before. I'm going to just tell you a little bit about how I got into this role. So we'll start all the way back after high school. I went to 4 years of college, and then after those 4 years of college, I went to 4 years of medical school. And then after that, I had to train in pediatrics, which is a fancy word for the medical field of children. So I did 3 years of training specifically in the health of children. And then after that, I did 3 more years of taking care of training in pediatric emergencies. So taking care of children when they get sick or injured. So if you add that all together, 4 years of medical school plus 3 years of residency and 3 years of fellowship, that's 10 years after college. So it took a long time to get here. But it was well worth it because I really enjoy my job. I love seeing young patients just like you because you are just so bright and kids heal so beautifully, and I like to be there for you when it's your difficult day. Okay, now I'm going to show you what we call the trauma bay, which is where we bring kids when they get really injured and we have to quickly help them. So I'm going to show you what it looks like. So as you see, there's so many different types of machines and supplies here to help us take care of you in case you get hurt. This is a cool thing because when kids come in and we don't know how much they weigh, we can use this to figure out how big they are. So a really big kid gets all the way to here and a shorter kid gets all the way to here, and based on that, we can figure out how much you weigh. I'm going to show you all the supplies and the warm blankets. So one of my jobs is to look at patients' x-rays. I'm going to show you an example of an x-ray. Can anyone figure out what this is? It's a patient's foot that we got to see if anything was broken. Hi, Dr. Scott.
Hello.
Can you tell us why you decided to do pediatrics?
Oh, of course. It's really exciting to be able to speak with kids like you and find out what they're complaining of and try and help them feel better every day.
Is this a SpongeBob cat?
Yeah. Do you like
that's
SpongeBob?
Cool. Hi, Nurse Nora.
Hi.
Can you tell us a little bit about your job?
So I'm a pediatric emergency department nurse. I work at nighttime. My job is just to take care of the kids.
And what do you love most about taking care of the kids?
I love their smiling faces.
All right, so as you guys see, it's 4:30, but it's 4:30 in the morning because we are always here 24/7 on holidays, on Christmas, on Halloween, any day, so that if anybody gets sick or hurt or needs to come get help, we're here. Hello, Dr. Rishika. How are you?
I'm well. How are you?
Good. I just wanted to ask you why you decided to be a pediatrician.
I've wanted to be a pediatrician since I was 5 years old because I loved my pediatrician, and I had a very minor procedure and thought the hospital was a very cool place and I wanted to help other kids.
That's a great, sweet story. How do you love your job today?
I love it. I love all of our patients that come in. We get to see a lot of cool stories, all ages. I especially love the babies and the toddlers.
Thank you. So that's a little bit about my job. And as you can see, I have a lot of different coworkers who also have different roles. So in addition to being a doctor, there's other roles like being a nurse or a pharmacist or a respiratory therapist. I personally love my job, and I wouldn't be doing anything else And my advice to you is to explore all the different things that you're interested in and see what it is that you like the most. Good luck. Bye.